Well, we're about a month into flu season, and doctors here are not only concerned with the rapid rise in cases, but another virus is going around. Fox 10 News' Dacia Smith now joining us live with that story. Dacia?
That's right. They've also seen a significant rise in RSV cases over the last couple of weeks, and doctors are urging people to be aware. It's already been a very busy and unusual flu season for USA Health.
Typically, this time of the year, we don't see that many cases of RSV and influenza.
Dr. Benjamin Estrada with USA Health says their flu infections went from 3% at the beginning of October to 12% as of last Friday. RSV infections are up to 11.5%. Other respiratory viruses are also going around.
We're also seeing a high number of patients with two other viruses that we typically don't see this time of the year.
The surge in infections could be thanks in part to fewer COVID measures, as well as the spread of COVID during the pandemic.
Very low numbers of RSV and influenza during the last 2 years, which means that a lot of people did not get the seasonal exposures to these viruses.
Dr. Estrada says doctors are paying special attention to children who are infected by RSV, especially those under 1 year old.
Their airway is significantly smaller than the airway in an adult or an adolescent patient. So those airways get inflamed much more significantly.
Which is why he's urging parents to be careful as we move through the fall.
They should consider to get the flu vaccination. Second, if your child is sick, please do not send them to school or daycare or trick-or-treating.
Now, Dr. Estrada did say that they aren't currently seeing a significant amount of COVID cases, but they are monitoring things just in case. He did also suggest that parents with sick children wear a mask while taking care of them to avoid getting sick themselves. And of course, if you or your child is experiencing severe respiratory symptoms, stay home and call a doctor as soon as possible. Live in Mobile, Dacia Smith, Fox 10 News.